This is Pharmacology Exam 4. This is session 18, I believe. Maybe 17B. Anyway, this is about the cephalosporins, but I only got through the third generation on here. So starting out, we have first generation cephalosporins. The nice thing about cephalosporins is they all start in ceph something. So we have cefazolin, which is given IV and is renally excreted, 60 to 100% renal excretion, and its half-life is about 1 to 1.5 hours. We have cephadroxil, which is oral, and then we have cefaflexin. So these are used typically for urinary and soft tissue infections, surgical prophylaxis. It's an alternative for penicillins. It treats all of the Streptococcus, E. coli, and Clostridium perfringens. So, way to remember this is I drew up here cefazolin. Zolin kind of sounds like Zorro, so I drew a picture of Zorro here, okay? So when you think of first generation, back in my parents' generation, the first generation, they had these old black and white Zorro movies. So Zolin and Zorro, you know, he has that pointy sword, looks like an IV. He's stabbing in people, okay? Intravenous, he stabs it in people's veins. So that's IV. Cefazolin is IV. Next, cephadroxil, rocks. So what do I have here? Zorro is holding a rock, cephadroxil. So he's holding a rock. And maybe I should put rocks because it's multiple. There he is, cephadroxil. And I drew smiley faces on the rocks to help you remember. When you imagine in your mind, cephadroxil is oral, okay? Next we have cefaflexin, okay? So Zorro is flexin, okay? Cefalexin, cefaflexin. So think of that. And the way you can remember that is you think of his muscle, he has a tattoo of a smiley face on his arm, which helps you remember that it's oral, mouth oral, okay? Next, and that is 90% absorption. So you think maybe he's 90% muscle mass. I don't know, however you want to remember that. Next here we have the second generation cephalosporins, and we have cefuroxime, which is oral or IV, renally excreted, 60 to 100%. Half-life is 1 to 2 hours. It's used for urinary infections, soft tissue, respiratory infections. Next we have cefaclor. Apparently cefaclor is somehow bound to or somehow associated with carbachafem, okay? So cefaclor, carbachafem. And this is IV, given IV, and it is associated with receiving a rash, and it has a narrower spectrum than the other ones. Next we have, also in the second generation, these two, which are both associated with cefamycin, which is the cefotetan and cefofoxitin, okay? And the way we're going to remember that, we'll go over here in a minute. And, okay, so these two, the cefamycin, are used for abdominal infections because they have increased anaerobic and gram-negative activity, so things like diverticulitis or peritonitis. And the second generation covers everything the first generation gets, plus it also does Proteus vulgaris and Providentia and Bacteroides, and yeah. So sorry, this one here, this is an narrower spectrum, whatever, but second generation, these first two, second generation are add-on Proteus vulgaris to everything that was mentioned up here, all the Streptococcus, E. coli, Clostridium perfringens. Oh, dang it, I forgot to add on, sorry. Going back, first generation, you notice in order to flex, Zorro had to strip. So all the Streptococcus, everything has Streptococcus in it that I could tell is covered by cephalosporins. And he did that because he wanted to look cool, okay? So E. coli was he cool, okay? Or he has cool eyes, he has a bandage on, so E. coli. And also because when he wears his shirt, he feels claustrophobic. That's what he tells people. So Clostridium kind of sounds like claustrophobic to me anyways. Clostridium perfringens. Okay, so going back here, sorry, the second generation. So how are you going to memorize all this stuff? So first of all, it adds on, including these other things. It also does Proteus vulgaris, and then these Cephomycin ones do Providentia, Bacteroides, and Proteus vulgaris. So how are you going to memorize this? Well, I drew here, first of all, a picture of an ox wearing a tutu, tutu standing for two, so second generation. The ox helps you remember Cephalosporins, so maybe you could think of this ox, has lots of fur. Here he is with all of his fur. And that's Cephalosporin, and he is eating an IV bag, okay? So that means that he is both oral and IV. So Cephalosporin is both oral and IV. Could be either one. And next we have Cephprosil, okay? So you don't know this, but this ox is actually a pro basketball player. So here's his basketball on the back here because he's a pro, and it has a mouth on it, okay? Mouth means that it's oral, okay? So a little mouth on there. Probably can't see that from back there, but I'll make it bigger so you can see. Here's a big mouth. And the thing, actually I'll do it this way. These two lines of the basketball look like mouths. Let's remember, that makes even more sense. Okay, so next, so we got Cephalosporin, Cephprosil. Now we have Cephaclor. So for Cephaclor, I'll actually hit that one in a second because it's easier if I do the fox one first. So Cefoxitin. So here I have the fox, Cefoxitin. And I guess if I wanted, I could put a little thing on his head like the Tin Man, a little thing. Anyway, so here's Cefoxitin. And Cefoxitin is IV. And you can see that this fox has an IV needle stuck in the back of his head. So just remember Cefoxitin IV stuck in the back of his head. Also, the foxes have really sharp teeth, almost like intravenous needles. You could think of that as well. There's his little sharp teeth with needles, IV needles. But don't think of his mouth, oh crap. Okay, never mind. Just remember IV, okay? And next, we have Cephotitan also, okay? So here's the Teton Mountains. I think those are mountains, right? So there they are, the Teton Mountains. And the way to remember that's IV is you think it's intravenous, so almost like the water almost look like veins coming off of the Teton Mountains. So intravenous veins coming off the mountains. Okay, so Cefoxitin and Cephotitan, those are both Cephomycin. Okay, they're somehow associated with Cephomycin. So what I did is I drew a mouse coming out of the fox's mouth, and I drew a mouse climbing up on Cephotitan. And that's why they're going to this mountain so they can get the mice, okay? So he likes the mice, so he's telling the fox to go to the mouse. Okay, to the mountain. Next we have Cephaclor. So this is a C facts book. It has facts and it has all kinds of lore in it, okay? So C fact and lore, this book. And it's on his back. Why is it on his back? Well, because it's kind of writing on his back. It is carbaxephin. So it's made out of cardboard, cardboard, I don't know. And it's on his back, okay? So cardboard on his back, so carbaxephin. And it's giving him a rash, okay? So you think of the Cephaclor, the C-Fact lore book. It's on his back for so long, it's giving him a rash back there. And it's kind of a narrow book now. So that's, help remember it's narrower. Okay, and anything else I'm missing? Oh, Cephotitan and Cefoxitin should probably help remember somehow that these are associated with abdominal infections. So for this, I'm going to actually draw this fox with this giant red infected belly. So there he is. So you remember the fox has to do with abdominal infections, and also the Teton, Cephotitan. I don't know how you're going to remember that, but here's a big belly on the mountain too that's infected. I don't know how you're going to memorize that. Okay, and that pretty much covers those ones, I think. So we'll move on to the third generation, which are down here. And so to remember these ones, I put drew one big picture that kind of includes them all. I'll name them first, say whether they're oral or whether they're IV. So we have cefixime, cefdinir, ceftibutin, cefpodoxime, ceftriaxone, ceftaxime, and ceftazidime. Okay, so there's 3 oral and there's 3 IV, and here's how we're going to remember this. Okay, so all right, this is a Tibetan Buddhist guy. Okay, so Tibetan, ceftibutin. Here he is. This is the ceftibetan. Okay, he's 3rd generation. How do you remember he's 3rd generation? I don't know how. I haven't figured that out yet. Okay, so he's 3rd generation. Oh, I know. He's 3 because he's next to. This is off of Picmonic. He's next to the 3 tree. Okay, here it is. The 3 tree. So 3 stands for tree. He's next to the tree. They meditate next to trees. So 3 for tree. 3rd generation. And this Tibetan Buddhist, in his right hand, or one of his hands, he's holding dinner. Okay, so that is cefdinir. And what do you do with dinner? You eat dinner. Okay, so cefdinir is oral. And with his other hand, he's holding his dinner in one hand. With his other hand, he's holding a hammer axe. Okay, it's kind of weird. So the hammer makes you think fix. So cefix me, oral. What does he fix? He fixes people's teeth orally. He's a dentist. I drew some teeth down here. So cefix me, oral. Okay, and then we have cefpodoxime. He's sticking out his foot here so that the podiatrist can get a good look at it. Okay, that's why he's sticking his foot out for the podiatrist. Okay, so cefpodoxime. And that is oral because the reason why he wants the podiatrist to look at it is because he's grown a mouth on his foot, which is a very unusual thing for it to happen. Okay, so he's oral, he has a mouth on his foot. And what is he doing here? He also has, on the other side of his hammer, this is a hammer axe. On the back side of his hammer, he has an axe, which stands for triaxone. Okay, so this is a triaxe. It's got 3 blades on it. See that? 3 blades. And it is bleeding blood. Okay, the triaxone is bleeding all this blood, and it's going to cause somebody to need an intravenous or an IV. Okay, because it's going into their blood vessels. Also, a little note here: triaxone. When you think the triax, think it's 3 times triax. It's 3 times the half-life. Actually, a lot more than 3 times the half-life. It has a half-life of 7 to 8 hours. But think long half-life when you see triaxone. And they use it to treat gonorrhea, okay? Because if you cut off somebody's thing, they treat their gonorrhea with this axe. Maybe that's a horrible way of thinking of it, but maybe it'll work. And you don't need to do any change for renal impairment with this stuff. Doesn't matter. You just chop it off. No change for renal impairment. Okay, so we got all these other ones now. Ceftaxime. What is the Tibetan Buddhist sitting on? He's sitting on his big pile of taxes. Okay, this is a big pile of all the taxes he hasn't paid yet, because he doesn't have his tax ID. When you hear ID, think IV. So ceftaxime is IV, intravenous. Okay. And lastly, we have this pitiful excuse for a Tasmanian devil. I was in a hurry. This is ceftazidime. The ceftazidime is he is eating his foot. That's why he has his axe out with blood on it, because this thing's bleeding. It's the IV blood is getting on it. So you also know this tazidime is IV. In case that doesn't help you remember, he has an IV coming in here. He's crazy because he has an IV of drugs. I don't know. Or maybe he needs an IV because he's been whacked with an axe and he's bleeding out a ton. So those are all the different ways you can remember those ones.